Welcome back to Frequently Asked Questions about Natural Migraine Relief for Women. This is Episode 5, Endometriosis and Migraine. Hi, Jeff Baker here again as your physician host for Frequently Asked Questions about Natural Migraine Relief for Women. Today I'm going to discuss the intersection of two common problems in women's health. In both migraine and endometriosis, there is a clear overlap in how root cause factors of hormone fluctuation and inflammation play roles in their clinical expressions. Endometriosis affects some 10 to 15% of women in their reproductive years. Common symptoms include heavy periods, pain and cramps with menstrual flow or intercourse, pain with urination, and potentially infertility as well. It is interesting to note that the more severe the endometriosis, the more likely the person is to have migraines. A recent study in the journal Reproductive Biomedicine looked at the relationship between these two, finding that 53% of women in the study who had endometriosis also had migraines. And of those, 65% of those migraines were related to menses, although 35% did not appear to be related to hormonal cycles. This translates to more than one-third of all women with endometriosis also having hormone-related migraines. This seems more than. There are several take-home lessons from this study. One would be to notice that the lag from the average age at the onset of migraines, which was age 15 in this study, to the age at diagnosis of endometriosis at age 28 was on average an 18-year gap. It's said that one typically suffers from endometriosis for around 10 years before the diagnosis is confirmed. For women who have had the symptoms of endometriosis and who also have migraines, early management aimed at both may reduce the severity of either migraines or endometriosis. It might hasten the rate at which the endometriosis diagnosis is made, or potentially all three. Another lesson to be learned, if you fall into the group of the one-third with endometriosis who also have hormone-related migraines, it would make sense to look, A, for the root causes the two problems might share, and B, find out if there may be some common strategies that would minimize the problem. Another interesting lesson here is that of those with endometriosis and migraine, 35% had migraines not related to hormonal cycles. This means that either hormones played no role in the headache, or potentially that they could have yet another root cause factor underlying both endometriosis and migraine. It's a good example of how there can be more than one root factor promoting a problem, and that we may need to look at managing more than one cause to find the therapeutic combination that best fits your story. I'd like to present two strategies that may help with both endometriosis and migraines. The first could be to reduce a surplus production of prostaglandin enzymes, which can develop in the 1 to 2 days before or into the first day of the menstrual flow. Prostaglandins can cause uterine muscle spasm that can promote or aggravate endometriosis. And when in excess, they can also affect smooth muscles and arteries throughout the body and promote migraine headaches as well. If you have either or both pelvic cramps and migraine headaches in the 2 to 3 days before or at the onset of menses, the use of ibuprofen every 6 hours with food or naproxen every 12 hours with food around the clock during the first 24 to 36-hour window before menses into the first day of flow can help to reduce the production of excess prostaglandins and minimize their effect on uterine cramping and migraine headaches. A second strategy to consider is using topical bioidentical progesterone cream in the 4 to 5 days before menses to moderate an overly robust estrogen effect known as estrogen dominance. One sign of estrogen dominance is being prone to PMS with typical symptoms of fluid retention, breast tenderness, food cravings, irritability, or depression, and others in the 3 to 7 days at the end of the cycle. One could start with 25 to 50 milligrams of progesterone applied to the inner arm or thigh area at bedtime on those at-risk days. You would quit using the progesterone when your period starts. You can readily find bioidentical progesterone over the counter at most health food stores. Do make sure that the ingredient label reads USP progesterone. Understanding the big picture on what drives your migraine headaches. I address both of the above-mentioned interventions in more detail, along with many additional focused therapy options for getting at the root causes of your migraine in the online course, Natural Migraine Relief for Women, which examines in detail the major root cause factors for migraine headaches and is written specifically for women with migraines. The Natural Migraine Relief course uses the unique Migraine Action Plan tool to help you assess the potential overlap of more than 60 health conditions and medical comorbidities. It will also direct you to which of more than 90 specific non-drug intervention options are most applicable to your migraine story. To learn more about this course, what it offers, and how to get started, go to www.naturalmigrainerelief.online. Also, remember to subscribe to this YouTube channel or my Substack blog at naturalmigrainerelief.substack.com to get weekly postings on frequently asked questions about natural migraine relief for women. Thanks again for joining me for this FAQ session, and I'll look forward to posting for you again next week.